I'd just like to say something to your. I'd like to pass on something to your state championship team. We couldn't be any prouder of you girls and for what you've done and what you've done for the city of Green River and bringing that state championship home. And I'll tell you something. This is something you'll remember your whole life. And everybody doesn't get a chance to do that. 46 years since they had the last championship, and you guys now can say, we did it. You're state champs. So congratulations. Does anybody else on the council want to say anything?
No, just congratulations on your award, and make sure you share that with everybody else, the rest of the team that couldn't show up, that we're all proud of them as well.
Yeah, congratulations, you guys. What a great job.
Thank you. Thanks, Steve. Yeah. We'll not take a minute break. They've already left. We was going to take a break for you guys to leave. Now on the agenda is the citizens' request and other communications. And now is the appropriate time for citizens in the audience to be recognized and to speak on items both on the agenda and of general concerns for them as citizens of Green River. So anyone that would like to come forth and when you come to the mic, would you please introduce yourself?
Thank you, Mr. City Council Member. I appreciate it. And to the City Council and to the Mayor, I hope you the best of luck with your health. I'm not from Green River, but I did marry a Green River woman, so I hope that counts.
That counts.
Okay. And what I'd like to say is thank you very much for your time and listening to me. And the Mayor did ask me to come in and talk about why I would like to ask for your help in masking up in Southwest Wyoming. Can you hear me okay through the mic? No?
It's muffled.
I'll take this off. So I'm pleased to inform you that our business is beginning to turn around after the global shutdown that occurred in the first half of this year and led to very difficult times for the soda ash industry as well as our community at large. We simply do not want to see global or regional shutdowns again, and that is why I'm here. We need your help. We have managed to control the spread of this virus at work. I have over 800 employees working in close quarters at times, but they're masked up and practicing social distancing to the best of their possible capability depending on the job they're working on. We can make this work in our community. Our social distancing policy at Genesis Alkali has been in effect since April 7th. Masks, staggering shifts when employees come to work, reducing how many of our employees are on the cage at any time, and that's how we get into the mine. The employees did not resist staggering their start times. They worked with us. The union leadership, you won't see them in this community without wearing a mask in town. Staggering maintenance and operational shifts at the start to minimize gathering at change houses on the surface. Reconfiguring maximum capacities in offices, control rooms, conference rooms, social distancing, time weighted. Not just we could be next to each other for 6 feet for 10 minutes. If it's a long day, we reduce the capacity of those rooms. Not just by fire codes, which is what we usually do for appropriate reasons. Staggering breaks and lunch times. Staggering meals. Meals are a high-risk activity. Take it from Susie and I. We both got COVID a month and a half ago. One dinner, letting our guard down for Susie's birthday with one couple. This is how we caught it. We need to minimize gatherings at all opportunity, and in my opinion, mandatory social distancing, masking up is what is needed to get us through over the next 3 to 4 months. And I think that's really how long we have to bear some very, very difficult times for this country, let alone our region. Genesis Alkali, our most recent COVID case, is very typical of the cases we've experienced. All have been from social gatherings outside of our facility. A young engineer who's been on vacation for 10 days, he reported yesterday that he's got the virus. He will not be coming back to work. Now, he can work from home unless he gets very sick. And today we're seeing many young people getting very sick. At any time now, I have 3 to 4% of my employees out of work. That's on top of my normal escalation. That's on top of my normal attendance, and it's escalating, as we all know and can read every day. Earlier this year, at best, when COVID started, I had about 0.5% of the employees out on top of my normal attendance. These are highly skilled jobs, running the mines and the 4 soda ash plants that we're blessed to have here in this region, and the surface facilities that are world class. When a bore miner operator is out, you do not just put anybody that's not trained on a 950 horsepower bore miner, or a longwall with 5,000 horsepower connected to that total facility to run that longwall. It takes highly skilled, highly trained operators. Or in charge of a self-directed operation on the surface that's highly automated. Takes training. Making matters worse, and with winter coming, these are water-based facilities. We take the risk of freezing these plants up. Some of you might remember one of the soda ash plants did freeze up. It took months to get it running again. So we're in the middle of putting contingency plans together, and these contingency plans are if we continue to see escalation of employees out of work, and we're concerned that we can't staff crews, we will voluntarily shut down specific plants to keep from freezing the overall plant up and for protecting our employees. Worse yet, this is not just about the business. I'm a businessman, but I'm also a citizen of this community and a family member. We have over 100 employees that are over 60 years old at Genesis Alkali. The vulnerable population that we're all aware of. I don't want to lose any of my employees to this horrible disease, and I'm sure you don't either. The situation is on the verge of overwhelming our hospitals. If we overwhelm our hospitals, we don't have COVID to worry about. God forbid somebody in this room or a loved one gets a heart attack. What do? What are the complications? Our schools are on the verge of having to shut down. I also represent, with the Trona producers, Simplot, Exxon, and others, we represent Church and Dwight. We represent a business education partnership working together to support business and the schools. We want to do everything we can, and the hospitals are included in that as well, to keep the children in school and keep them safe. The situation, in my opinion, and I believe it's a culture, we're very experiential. But by now, most of us know somebody, as we talked about today, Susie and I, that have had this disease. We were very lucky. Many people also believe it's a political disease. Well, someday the election will be over, right? Maybe not today. There's nothing political about life and death, folks. Nothing. And people are dying, as we know, in this community, in the state, and across the United States from this disease, as well as globally. In summary, we really are asking for your thoughts, your prayers, and your help in keeping our employees and our community members safe and helping us from overrunning our hospitals, taking care of our wonderful healthcare employees, our teachers, and our students. We need your help. We truly need your help. Thank you very much for your time.
I have a couple things to make a comment about it. I'm
Thank-
going to do it at the end of the meeting. Now,
Thank you.
so we'll let the
Okay. Thank you very much.
Thank you for allowing us the opportunity to speak. Can you hear me on that? Hope so. My name is Gina Young, and I am here representing myself and other concerned citizens from Sweetwater County, not just from Green River, but mainly from Green River also. I came tonight mainly to address each of you on the mask issue also because I was under the understanding that there would be some discussion on this tonight. I did send out an email to all of you about an hour and a half ago because my printer totally lost its ink and I could not bring you any information that I want to present you on data and actual links and resources that you could refer to. So I hope that if you haven't had a chance to look through that you will be able to over the next couple days. So considering that I just learned 40 minutes ago that Sweetwater Now announced to our community that, I'll just read it right here, breaking, the mask mandate variance for the Sweetwater County requested by Sweetwater Public Health Officer Dr. Jean Station was approved on Tuesday afternoon this afternoon, by the State Health Officer Dr. Alexa Harris. So it's all out of our hands. I feel that the transparency on this decision has been very weak, that a lot of us have not known what was going on behind closed doors unless people were able to share that information or to alert people that they knew that may be concerned or want more information on that if you weren't working at the mines or if you weren't able to get on the governor's Zoom call for businesses recently when everybody got shut out, when there was the 100 limit and they tried to open that back up to 1,000, and then those who had already been on weren't allowed to be on that and voice their opinions or their concerns. So I did want to let anybody know who's participating tonight. Maybe you guys as council members could support us in attending that meeting that they are holding tomorrow. It is at 7:15. This was all just announced just very quickly and short, so not anybody had the opportunity to get like a week's notice to their work. But tomorrow at 7:15 there is a meeting at the Sweetwater County Health Department at 333 Broadway on the second floor meeting room next to the VA office. They plan to hash out details of how this will be mandated and enforced, including the wearing of masks in vehicles, vaccines, and also closures. What does this also look like for medical exemptions? I don't know, but I am here speaking as someone who is immune compromised, who has been dealing with immune compromisation for over 13 years, and I have been a research patient at the University of Utah. So I do not take my health lightly, and I do work very much on collecting data and also looking into and doing research on our health and the things that are going on around us in our community. I'm addressing the email, which if you haven't had a chance to look at, I'm not going to go through all that now because it's almost not even, I don't even know, talkable now that it's already been passed and we didn't really have a say, it didn't go to vote. I do feel and want to voice my opinion that I believe that we are on a very slippery slope, allowing one person or any small group of unelected people to coerce and not present true facts or data with sources and be allowed to jump hoops to make such decisions or work to take away any communities or people's rights to choose, especially when it comes to our medical freedoms and our constitutional rights. I feel that we have some scary times ahead of us because of this. Not only is this person speaking for just herself or the medical community, but she's speaking for Green River and Rock Springs and now overall Sweetwater County, when I am not sure that this went to vote from many of those different entities per se. I recently talking to physicians and doctors in the area, and I think we also need to keep in mind the rates of suicide amongst not just only our teens but adults is higher. The death rates of suicide is higher than our death rates of COVID. And I really think that we need to be aware and doing our research, following true data, not just listening to one person's opinion or even 3 or 4 people's opinions on what they want to tell you is happening in Sweetwater County, because what they're saying is not following the true data or the facts that is out there, and every one of us have access to that. So I just encourage all of us in Green River and from our city council to to stand up and to protect our medical freedoms and our constitutional rights, and being able to either bring us to vote or to have our elected officials represent us, not somebody who is not elected and maybe possibly doesn't even have an official contract with the state. And that is in the email also. And I would like some help with that once you guys read that, if you're able to help us find out that information. So I appreciate you allowing us to speak tonight, and just thank you.
No, wasn't. Good evening, Mayor and Council, and thank you for the opportunity to come before you tonight. It's been a while. Haven't been able to give updates and what have you, but I wanted to come and share this year in review, so to speak, with where we are with the trash and recycling for the Green River City. To start with, for recycling, after a lot of searching, we were able to finally secure a sort facility that is taking the commingled recycling that we are collecting curbside. This recycling product is being taken to a waste management MRF sort facility in Salt Lake City. Just to kind of let you know, the audit reports on the loads that we have taken are showing about 24% of the load is cardboard, 30% of the load is box board or chipboard, which is like your cereal boxes or your pop boxes. 13% is mixed paper. 7% is the PET, plastics number 1. 5.5% is the HDPE, which is plastics number 2. And then 2% is like tubs, lids, and rigid plastics. 3% aluminum. 4% tin and steel cans, 1.5% other scrap metal, and then there's 10% that is residue, which is trash. So per load, we're roughly around 3,000 pounds, and so this equates to about 300 pounds of trash per load. In reality, yes, that seems like a lot, but I really think that it is far less for a new program starting out. So we want to thank all the Green River residents for being diligent about the products that they're putting in the container and being attentive to the flyers or recommendations that we have when asking them to recycle this or change this, and this can't go in the container. So we've had a lot of good results, and we will continue that education as we move through the recycling program. And just so everybody is aware, the calendars for the recycle and yard waste will be mailed out in January with the January billing. They will be available on the website probably late December, but they will be in the January billing as well. On to digital media. Our Waste Connect app, we can assume that we have approximately 75 Green River residents that have downloaded the app, and they receive service updates and reminders via the app. We have several residents that have actively participated within our Facebook page. We have a lot of visitation on our website. We do also make sure all alerts and service issues are on those websites and our Facebook page as well. So those are apps that we are monitoring. We actually have a third party monitoring that for us, and they give us any resident comments, good, bad, or ugly, and let us respond, and we're able to respond to them. On to our holiday schedule. We are approaching the holiday season, and just to remind everybody of the schedule as it comes forward, Thanksgiving Day, Thursday, the 26th, the transfer station will be closed. It will be opening again on Friday, the 27th, normal business hours. The resident and commercial services will be delayed by one day. This putting Thursday's pickup on Friday, and Friday's pickup on Saturday. Christmas and New Year's Christmas and New Year's Day both fall on a Friday. That being said, the Thursday of Christmas Eve and New Year's Eve We will be closing the transfer station at 1 p.m. as that is when the solid waste district landfill is also closing. And then they will be closed, transfer station will be closed Christmas Day and New Year's Day, and again opening up the next day, which is Saturday, normal business hours. Again, residential and commercial services will be delayed for Friday customers only, Friday being picked up on Saturday. We will be running the ads for the delayed schedule in both the Green River Star and the Rocket Miner. We will be having our introductory phone message also stating what the delay is, and our Facebook page and our website will also have the delayed holiday schedule listed. As for the transfer station this year, we did see a considerable increase in traffic. Year to date, we have seen 2,251 residents use the transfer station. This is up 282 residents over the last year. 508 of those residents have disposed of 1,000 pounds or more. Again, this is up 158 residents from 2019. 129 are at their 1,800 pound limit or more, and this is up 33 customers from 2019. The average being disposed of per resident is 652 pounds. This is also up from 71 pounds per resident from 2019. We do attribute this upswing to the COVID pandemic. As April and May, many people were home. We've seen high traffic flow during these 2 months. We had almost an 8-week period where we had an average of 100 customers a day for the days that we were open, and that's the only time that we have seen that. Usually it's on the weekends or after a holiday or something like that. So quite a big uptick in that respect. There was a lot of cleanup happening and a lot of loads coming in during that time, and it was actually kind of nice to see. It was kind of, my operators were busy and nice to have it. And finally, down to the annual price increase. As we are approaching 2021, it is that time we need to bring up the price increase. In using the CPI from September 2019 to September 2020 for all urban customers as prepared by the United States Department of Labor and Bureau of Labor Statistics, the CPI parameters listed is at 1.37%. In dollar terms, it is a 45-cent increase per month for residential customers. For small businesses, the average increase will be approximately $1.50 per month. As with last year, we will give notice to all customers that there will be a price increase effective January 2020. The message will appear on the invoices mailed in December. And in addition, we are asking for the same PI to extend to the transfer station. This would increase the tonnage rate from $70.24 a ton to $71.20 a ton. And that was all I had. Thank you very much. Yes. Yes, there was a few hiccups, but yes, we were able to get it, and we have reviewed and double reviewed and triple reviewed our calendar to make sure it's right, so we don't have to send a revised one this year. We have gone through it very diligently and thought we had done it last year, but apparently it did skip by, but we have done that as well. So. Mm-hmm. Mm-hmm. Yeah. Great. Yes. Yeah, we have definitely. It's a one call blast app that we're service that we're using with that, so it makes it very very convenient that way. So it is nice. So I appreciate that. Thank you. Thank you.
didn't have my mic on, so nobody heard me. So that's probably good. These were the statistics that came out in the Sweetwater Guide today. It says the number of lab confirmed cases in the past 24 hours is 40 in Sweetwater County. The number of active lab confirmed cases is 293. The rate of lab confirmed cases is 2,567 per 100,000. This is Sweetwater County. And the number of probable cases is 64. Total number of cases recovered is 826. And today was one of the first days that now that we're having more cases than we're having recoveries. And so I'm not trying to be argumentative with anybody. I do think that the government needs to step in and help out, but I don't know how much we can do. I'd like to ask our attorney if you know, my understanding is the city cannot mandate it. It has to come from the governor. I don't know if I'm right on that. It could be a county or...
Mr. President, members of the council, you're correct. It's the statutes are clear that the direction in this regard is vested in the state health director.
Okay, so that kind of might answer your question, Gina, that's where the responsibility lies. So, and the mayor asked me to mention this, and I saw in the news today that the state of Wyoming COVID cases are up 63%, and that was on the national news. And so I don't know if that's right or wrong. It's just what they reported on the national news. And so I would hate to see one of our plants closed down. We'd be in deep trouble in Sweetwater County if one or two of our Trona mines closed down. So, and does anyone else have any comments on that? Lisa.
And I believe you were on the virtual call yesterday. And I popped in there and was listening to the different comments, and I really don't agree with mandates. I really want to trust the people to do the right thing. I know, speaking for myself, I can wear a mask for about, I guess, 40, 50 minutes, and I start having an anxiety attack. And I have to just rip it off and breathe. That's me. I asked a question yesterday, and I think most people have been pretty good about it. When the kids went back to school, when the college went back to school, and you know, the kids at the college and the kids are going to hang. When I drove by the grade school that I live by, you know, they had the kids distanced in school. They had them wearing masks in school, but when those kids were out on the playground, it was just all, you know, they were all over the place. They were not staying away from each other. You know, and sometimes you can't help those kind of things, you know. I mean, I feel really bad for the kids this last, you know, year or partial year with this going on, because it's got to be really hard for them. And I understand the concern. I work retail, and I said that on the meeting yesterday. I said we have a big enough store that we're very distanced from our customers. And our boss has given us the latitude to either wear a mask or not wear a mask. We wipe down everything, we spray everything, we keep it very, very clean. And we've been doing that since the 28th of April. And we get people from all over the country in our store. It's not just people in our community. We get people from Canada, we get people from Iowa, people from California. But, you know, we keep our distance and we take care of things, and you know, we're keeping things clean. And when I do go to the grocery store, I do wear a mask because there are a lot of people in there. The other thing I do that I don't see a lot of people do is stop to wipe off the handles. And I think a lot of people forget about that. We're constantly cleaning our handles at the store. You know, about every hour or so, we're out there disinfecting those things, disinfecting our counters. You know, so there's a lot to be said about that too. I would hope that, you know, if someone is sick, they stay home. You know, you told our employees the same thing. You're sick, you stay home, you get tested. And I see they have a what is that, spit swab test? Not for the nose, but for the saliva, right? Okay, they have that available for the businesses, is what we were told on that call yesterday. The other thing I asked, and a lot of people don't ask about this, and kind of got shut down real quick, but I asked about medication. You know, what when I go in and I have COVID, or if I have strep throat, or I have something, why can't you give people something for that? Why can't, there have been medicines out there, and it was like, I just got told, well, there's nothing, and there is something. I've seen it on, the news. I've read about different things that people can have. And I just don't understand why when somebody gets something, and especially if they're one of those people that might have, more at risk, why they're not given something, and that would keep them from going to the hospital. But, I'm sorry, guys. I got shut down on that call, and I was kind of shocked, But I do know that there's medicine out there. I have a friend that has a daughter that had COVID. She lives in North Dakota. Just called me 2 days ago and told me that she was going downhill, and this is probably a person in their late 30s, she's not very old, and started going downhill, and the doctors put her on the hydroxychloroquine combo, and she's fine now. She's not going to the hospital. She's getting better, and I just don't get it. Why something, things like that are not being used to stop the progress. I have another friend in Denver that got COVID, and they didn't give her any medication. She's probably in her 30s too. They gave her I guess it was an inhaler, some kind of inhaler to help her breathe. But that poor girl suffered for a month. And maybe she could have got over it right away with some of this other stuff, and she ended up getting mono later, because if you have that and you go through a long time being sick, it also causes other symptoms and other things to happen to you. So anyway, that's just my 2 cents. I do want people to take care and keep their distance and sanitize and watch what you're doing around others, but I wish they would use some kind of medication too. I just wish that was happening. That's my 2 cents.
Does anyone else have any comments? Mike, did you have any comment?
No, I think the issue we're going to run into, if you were to look at any of this, I'm not really for mandates myself, but if you were to look into this, you're going to have an enforcement issue that is going to become so unbearable that I don't even think we know the extent. That's a big problem with it. People have to be trusted.
Yes.
Trusted once before without mandates.
Yeah. And I agree with that. And it's hard to mandate, and what's really hard with the mandate is to enforce it. That's the hard part. But the city of Green River can mandate it in every building. And if you walk through that front door of that building, you either wear a mask or you don't come in. We have a right to do that, but I don't think we can go in and mandate a store. Jim?
I too feel that it's something that needs to be voluntary. I wear a mask when I go into a store that says wear a mask. I look at this as being an instrument that when I'm in a situation where I can't distance by 6 foot, I need to be wearing it. So I think it needs to be voluntary, because I really don't think the citizens of Green River and Wyoming want to enter into that realm of the government mandating something personal like this. So I really believe our constituents, really as a whole, don't want this. So I think part of the problem is we have stores, larger stores, in our community in Rock Springs and stuff, that'll have a sign out that says you're required to wear a mask into this store, and you go into the store and half the people are not wearing the mask. So I think it needs to start on an area where
if they're going to put a sign out like that, they need to make sure that they enforce it in their store. That's just what I believe. If they're not going to enforce it, it's just like telling the people, well, we're putting this out because we have to, but it's not really bad. Don't worry about it. You see people, kids, families running through the store without masks. It's just something that I believe your retailers are saying, well, we've got to do this, but it's going to affect our bottom line, so they don't enforce it. And so it sends the wrong signals. But as far as enforcing this, Chief Jarvie has mentioned it on multiple occasions that this would be extremely difficult to enforce. And if there were any types of fines or arrests on something like this, be well known that a person that they could demand a jury trial. I mean, they can demand if they're being arrested and they're going to be before, they can demand a jury trial. You imagine what that would do to our court system. It would be unbelievable. And these would be people that would be demanding a jury trial so that they can voice their rights that they feel that they've been trampled on. So it would do a mess to our court system. It would back it up. It would be unbelievable. And I think a lot of people in Wyoming would demand a jury trial or want to voice their rights. So it's just not one thing saying, okay, everybody's got to wear a mask. It's quite a tangled web when you look at the whole picture. So I too would not like to see mask mandates. I think it needs to be on a voluntary basis. I wear a mask when I need to, and that's just where I'm at. So thank you.
Is there anyone else, even in the audience, that has any comments? Would you please stand up at the and speak? Tell us your name. Is it
Were you
on?
all aware that it had already been approved?
Would you?
That Dr. Harris had already approved this? Sorry, what?
This is news to us.
Okay, that's what I thought. Just wondering if you guys knew that.
I'd like to go back to our attorney and ask him a question if he's got the answer. I don't know if he does. Legally, what can the city do? Legally, what can the city do?
About
masks?
what?
About masks. About
Well,
wearing
the city
masks.
can't impose a mask mandate. That's done if there is a mask mandate imposed, and were 3 counties before Sweetwater County that order came down. I don't think the order has come down in Sweetwater County yet. Okay, it's been issued? Okay. Because I wasn't, yeah. But you'd have to read the order and see what the mandate is, but that happens by statute at the state level.
So what you're actually saying is we personally can't do anything. It has to come down from the state to
Yes.
do that. Gina?
What I was presenting earlier is they have announced that there is a meeting tomorrow morning. It is at 7:15. There's any notice for anybody to attend that. It does happen at the Sweetwater County Health Department at 333 Broadway on the second floor meeting room next to the VA office. That's where they're going to be discussing how they're going to be enforcing this mandate and getting information from people who attend that. They're also going to be talking about vaccines and also possible closures that they will try to enforce on us without our say on that. So if this is coming down from Alexa giving her power, or however that happens for this Dr. Stations, I feel that we need to have our people there, and obviously we'll have, I hope, our attorneys there, or our county sheriff. I don't know how that works out, but I hope that those people that are able to speak up for our rights will also be in attendance at that meeting, because it was last minute notice, tomorrow morning at 7:15.
So everyone is aware of that. Please come forward.
First of all, I very much appreciate the dialogue and the views of many people from Wyoming, and that's why I love Wyoming. But what we have proven, I can control what goes on in my facility with my 800 plus employees, and I can tell you they're safe when they're at work. They're not as safe when they're in this community. And I think we all have a responsibility to that. Volunteer is fine, as the governor said, as long as we do it. And the governor is getting very frustrated for those of us that have heard him talk. I just think before this gets out of control, we need to think, and perhaps, Mr. President, it's at least controlling what we can control, as you said earlier. And if we systematically do that, more folks will follow. And just because it's the right thing to do, not because they're mandated. At the end of the day, I can understand businesses where, in Rock Springs we have a couple grocery stores. If one is telling you politely that you have to wear your mask and you don't like wearing a mask, you go to the other one. So they're a little afraid to enforce it. It takes the leadership of us in this room to give them cover. It's going to take the courage of the leaders in the community to do some very tough things. And my fear is with these coming 3 or 4 months before the medication is well available, my fear is it could get very bad. I hope that doesn't happen. I hope I'm wrong. And I hope you can say, Fred, you wasted our time up here. But my fear is it could be a very bad winter. And I'm going to do everything I can to protect my employees. And I hope you do the same. Thank you for your time.
Thank you. The argument I have on this is, what's wrong with being a good citizen? What's wrong with us when we get in a group to wear a mask? What's wrong with us when we go in a store that has, please wear a mask? What's wrong with us wearing a mask when we're asked to do that? And so I just know that that's why I asked our attorney, legally, we as a city can't really do anything. It has to come down from the state to mandate some of that stuff. And I've talked to Chief Jarvie many times, and he said it'd be really tough to mandate. But I will say one last thing. Our kids are probably safer in schools than they are in other places because they have to wear a mask. And they wear a mask. And so they're probably safer there. And so I don't know what we can do. I know it's a real sensitive subject. There's people on one side, there's people on the other side. But my opinion is let's just be good citizens and try and be safe and keep other people safe. Is there any other comments? If that's it, we'll go ahead and take a 1-minute rest for those that don't want to stay to the rest of the meeting. If they would like to leave, you're welcome to. You're sure welcome to stay. It's going to get really good later on. No. Okay, we'll go into now to resolutions. I tell you what number it is, but I can't read Roman numerals anymore. Do we have appointments? Oh, we do. We have Board of Appointments.
It's B1.
B1. Board of Appointments. Reappointment of Judy Roderick to the Green River Arts Council. Is there a motion?
Mayor?
Lisa.
Or, whoops.
We're informal tonight.
Okay. I move to approve the reappointment of Judy Roderick to the Green River Arts Council for an additional 2-year term.
Do I hear a second?
Second.
Is there any discussion? Hearing no discussion, those in favor, say aye.
Aye.
Opposed? Passed unanimously. It's on. I'll get it closer. Okay. Can you hear me now? Okay. Resolutions. Consideration of a resolution to apply for cases. CARES, that's right. Apply for CARES Act funding through the state of Wyoming.
Mr. President, kind of shortened that up a little bit from the speech on there, didn't you?
Yeah, I did.
I don't blame you. It's a long worded motion. Tonight you'll see where the city's applying for the CARES Act funding that was appropriated in, I believe it was appropriated to the state in March time frame. The state came out with guidance to us around the June time frame. And the reason, this is the last time we can apply for it, and one of the reasons we are applying for this money at kind of this late in the game is the rules have been changing on us almost on a weekly basis. And so we're just getting around, and we've been trying to match those rules and get everything excited. We're confident in everything that we've applied for, about $112,000, sorry, in the 4 resolutions that we applied for are going to be before you tonight are very much reimbursable. But you'll see we did break them up in 4 resolutions on purpose. One of the things we've noticed with the state is sometimes they get a little finicky on a couple things in your resolution, so we broke them up on just in case they throw one out, we don't lose all 125,000 or 112,000. Sorry, I don't know why I'm 1 1/4 is in my mind. We could just round it up if that's okay. But we want to make sure that if they have one technicality, they don't throw out all of our money, and so we've split it up strategically in 4. We do believe all 4 will pass. We have documentation already ready to go and submit to the state to meet their December 15th deadline. In fact, we will be signing these resolutions tonight so we can get them overnighted to Cheyenne tomorrow because they have to be there by Thursday. So we're, in fact, that was one of the new changes we found out as of this week, that all these applications had to be in by this Thursday. Otherwise, we'd have put them on the last council meeting. But overall, that's what the resolution is. This is similar to the CARES Act funding and the Employee Act funding that all the businesses and that were received since around February and March, right in there.
So all of these CARES fundings are just separate amounts of money, and this one here is for $48,335.10.
Correct. Each one's for a little bit different of a topic. The $48,000 one is mostly for invoices, technology, things like that, things that we've bought. The Chromebooks that we distributed to the council last night to continue running and do virtual meetings, our sanitizing stuff, masks, any of those things, and we're pretty sure that's going to come as a no problem. The state's going to reimburse that. There's one for all of our employees that have been quarantined. There's an act out there that requires you to pay them a minimum of 2 weeks if they're quarantined for any reason. We're submitting, I believe it's $27,000 for that. There's $12,000 for the members of our council, or our department heads and supervisors that were on the EOC team earlier in April, May, and June. We're asking for reimbursement of their time to serve specifically on that Emergency Operations Command team, where they spend a significant amount of time working with that, making sure things are running in that. So there's some money there. And the last one is our additional sanitizing in that we do with all of our programs. We opened our programs back up, which was great. A lot of places still haven't. But that comes with a cost of, you got to sanitize everything before someone uses it, and you got to sanitize everything after somebody uses it. In the middle, there's some sanitizing, and so that adds extra hours. There's around $25,000 asking for reimbursement just in extra cleaning, whether it be weight equipment, whether it be toys for the grass program, whether it be chairs, all that type of stuff. The cleaning of the council chambers after every council meeting where we have public come in. So that's in general what we're requesting for reimbursement on these CARES Act funding. We're pretty certain they're all great things and we'll get reimbursement for them. But we didn't want to throw all of our eggs in one basket because we knew we had one shot at this right now. And so we're taking that shot with 4 separate resolutions in case they find a technicality in one of these resolutions. We don't lose all the money at any one given time. We'll have the opportunity to get at least some of them in case they find something they don't like in one of our resolutions.
Anybody have any questions of Chris? Thanks, Chris.
No problem.
So the first, the one, A, the consideration of a resolution of applying for CARES Act funds through the state of Wyoming. This one is for the $48,335.10. Is there a motion?
President?
Councilman Sutphin.
I move to approve the resolution as attached, authorize the mayor to sign the resolution and the grant agreement issued by the Wyoming State Land and Investment Board after approval by legal counsel.
Second.
Second by Councilman Berg. Is there any discussion? Hearing none. All those in favor, say aye.
Aye.
Any opposed? Motion passes unanimously. Item B, consideration to approve a resolution to apply for CARES Act funding through the state of Wyoming. It's basically the same thing that you talked about, Chris, and this one is for $27,588.09. Is there a motion?
President,
Councilman Shetman.
I move to approve the resolution as attached, authorize the mayor to sign the resolution and the grant agreement issued by the Wyoming State Land and Investment Board after approval by legal counsel.
Is there a second? Councilman Murphy, did you second that?
Yes.
Is there any discussion? It was moved by Councilman Shetron and seconded by Councilman Murphy. All those in favor say aye.
Aye.
Opposed? Moving on to the next one, consideration of a resolution to apply for CARES Act funding through the state of Wyoming. And this one is for the $25,084.30. Is there a motion?
President,
Councilman Murphy.
I move to approve the resolution as attached to authorize the mayor to sign the resolution and the grant agreement issued by the Wyoming State Land and Investment Board after the approval by legal counsel.
Is there a second? Second. All those, is there any discussion on this? Hearing none, all those in favor, say aye.
Aye.
Opposed? Passed unanimously. And item D is consideration of a resolution to apply for CARES Act funding through the state of Wyoming. And this one is for the $12,526.62 that Chris explained to us. Is there a motion? Councilwoman Mays.
I move to approve the resolution as attached, authorize the mayor to sign the resolution and the grant agreement issued by the Wyoming State Land and Investment Board after approval by legal counsel.
Second.
It was moved by Councilwoman Mays and seconded by Councilperson or Councilman Berg. Is there any discussion? Hearing none, all those in favor say aye.
Aye.
Any opposed? It passes unanimously. Now we'll move on to council action items. And item A is consideration of an agreement with Lucky Dog Recreation Playcraft Systems.
Good evening, President and members of the council. Brad Rennie, Parks and Recreation Director. Happy to present something kind of fun to you all tonight after heavy discussion tonight. Back in March, we applied for and received a grant from the School District Number 2 Rec Mill Board. A couple of weeks later, we were all locked in our houses. We were hoping to get right to work on it and have this ready for the summer, but for a little while, there's just a lot we needed to figure out. So anyways, we finally put this project out. We did a request for qualifications and proposals, and we received 8 different proposals from 5 different vendors. And we had a committee of, there was some members of the council, of the school board, some residents of the neighborhood around Edgewater Park. Quite a few people came in and rated all the proposals, and this was, I guess, the winner here. So we'll be getting our first covered wagon play equipment in Green River. So this company did a good job. She made the trip out here, and you could tell in her presentation that she was able to provide something unique within the budget that we had set forth. This is just a rendering of it there. It'll be installed by Memorial Day is the plan, is what's in the contract. So tonight, this is just the agreement to move forward with this company to allow them to start ordering the equipment so we can install it in May. Do you have any questions? Anybody have any questions?
Does anybody have any questions of Brad? Thanks, Brad. Is there a motion?
President,
Councilman Shuttron?
I move to authorize the mayor to sign an agreement with Lucky Dog Recreation Playcraft Systems to replace the playground at Edgewater Park in the amount of $95,000 pending legal approval.
Is there a second?
Second.
It was moved by Councilman Shuttron and seconded by Councilman Murphy. Is there any discussion? Or did I already ask that? I probably did. All those in favor say aye.
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 Oppose? Passes unanimously. Consideration to approve the amendment to the city purchasing policy. Item B. Chris?
Mr. President, Council, we're bringing forth to you guys our purchasing policy. We haven't reviewed that, I believe, since 2018, if I remember correctly. We've changed a lot of our, I won't say a lot, but we've changed some of our general practices. We've implemented some cost-saving measures in that over the last few years, one of them being the $1,000 form. And one of the things we've also noticed is our vendors don't want purchase orders anymore. So that's the two big changes. We've also don't have a purchasing department anymore, and so we've stripped that out of there. You'll see the red line copy has been provided for you in the packet. For the most part, it's just streamlining our process, taking out the purchase order unless the vendor absolutely wants one, and then putting in that $1,000 form and the parameters with that. We've been doing that $1,000 form for 4 years now, Reed? Something like that. I won't tell you that everybody loves it, but it is a good tool for us to kind of monitor things and help departments look at things. But it does strip out the PO requirements. I mean, if we're already doing a $1,000 form that the Reed, the city administrator, and the finance director have to both sign, why do we do that again in a purchase order form? So we're duplicating some stuff, so we're trying to streamline some of that process. We didn't get rid of anything in there on second written quotes and that. We're still sitting basically the same dollar amounts, same thresholds. And that would be the only question. And with that, I'll just entertain any questions if you have any.
Does anyone have any questions?
No, it's just housekeeping pretty much, right?
For the most part, yes.
Thanks, Chris. Is there a motion? Councilman Zimmerman?
Mr. President, I move to approve the city's purchasing policy, Administrative Procedures Regulation Number 73 as amended, and authorize the city administrator to sign said policy.
Is there a second?
Second.
It was moved by Councilman Zimmerman and seconded by Councilman Shuttron. Is there any discussion? All those in favor, say aye.
Aye.
Any opposed? Passes unanimously. The next item on the agenda is the consent agenda. Is there a motion?
I move that we approve the consent agenda.
Second.
It was moved by Councilman Shuttron and seconded by Councilman Berg. All those in favor, say aye.
Aye.
Any opposed? Passes unanimously. We'll move now to the city administrator's report.
Thanks, Council President. One of the, having heard that the mandate passed, which we didn't know, on that, if it was in the last hour and a half, we will review that tomorrow. We'll try and see who's taking part in that meeting. My guess is they're just looking to see how it needs to be, how they're going to enforce or what that's going to look like. What some of the, there's got to be some deal tied to closures. There's got to be a whole lot of stuff we don't know, and so I have to take a look at that. We'll dissect that. We'll get that information out to you. We'll decide if there's any other discussions we're going to need to have as a council or as within the city. We'll make sure that we get that communication out internally, externally, because as it will affect not only government but businesses, people, personnel, staff. I don't know how it even affects us at this point in time, but That also, just as an FYI, we are planning to help from a voluntary compliance aspect and trying to help curb the pandemic, the numbers that we're facing here in Sweetwater. We are planning to move our next council meetings going forward to virtual. So that has been sent out already. We'll make sure that well, of course, we'll be going out to through the media that we have to do, but that will be, I think, for the foreseeable future here, just at least for the next, probably through the end of the year for sure. So we'll go from there. That's all I have.
Thank you. Attorney? City Attorney?
I have no report tonight, Mr. President.
Thank you. We'll start with Councilman Berg tonight.
I've got just a few thoughts as we come to the close of this meeting. And that is a couple of things that my grandma used to say. And that is, an ounce of prevention is worth a pound of cure. And another one being, treat others as you would want others to treat you. You know, it's one of those, I've wore a mask at work 10 hours a day, 5 days a week for the last 8 months, and it hasn't killed me yet. And the last thing is, this past Sunday, after church services, at a house of worship, there was a verbal altercation over the wearing of masks that just completely appalled me. But I can't fathom us asking our police department to enforce fines or arresting them. I can't even fathom putting them in that position, especially with the way the things are in the world right now. So those are just my thoughts as we close.
Councilman Murphy?
I have nothing tonight.
Councilwoman Mays? I just about asked Steve to say something.
I don't have anything. I already spoke my piece earlier.
Councilman Shetron?
I'd like to commend the city for the lights that we have, the holiday lights on the streets now. Those are a welcome sight for everything that seems to be going on. But I did speak with quite a few constituents from my ward and others in the community, and I would say there's an overwhelmingly lopsided view of this as far as people not wanting the mandate. I mean, there's a lot more that would hate to have a mandate than the few that are actually for it. So,
thank you. Councilman Zimmerman?
Nothing more than what we've said and added tonight. Just want to wish everybody a happy Thanksgiving coming up, and hope they can be safe and try to enjoy it. My wife and I are going to be home alone with a turkey breast a frozen turkey breast. That's as close as we're going to get to a turkey meal. So we'll warm it up. Yes, we'll microwave that baby. So that's all I have, Mr. President. Thank you.
Thank you. And the same in my house. We canceled our Thanksgiving because we'd have 50 people coming to my house, and we decided that's not a good thing right now. So it's just me and my wife as well. But I would like to say just one thing on the mask thing. I've received a couple of emails too, maybe more than a couple, and the ones I've received are people that are highly opposed to it. And mandating something is none of us like that, but maybe sometimes some of those things have to happen. But one thing I want to say, that there's both sides of the fence on the mask, and reasonable people can disagree and not hate each other. Just because one person is on this side and one person is on this side, there's no reason to that cause a fight or an altercation, like Councilman Brewer was said. People have different opinions. We just need to respect each other's opinions. And reasonable people do that. And that's all that I have. And I've always wanted to say this. Does anyone like to, what is it? To close the meeting? Make a motion to close?
Mr. President,
Councilman
I make a
Shetland.
motion that we adjourn.
Second by Councilman Zimmerman. Anybody in favor? Aye. Opposed? It's over.